Hi there, it's Dr. Tamara here, and I want to talk to you today about egg freezing, or what we call oocyte cryopreservation. It was about 20 years ago that this technique was developed. In fact, it was developed over in Italy. And what they discovered is that they could collect a woman's egg and they could freeze it right then and there and then thaw it out at a later time. And would behave as if it were a fresh egg. So it would have the same fertilization potential, implantation, creation of embryos, and pregnancy rates as a fresh egg. So it was really reassuring that this technique could be developed and then used. Who are the sorts of women that we offer oocyte cryopreservation to? Well, we offer it to women with medical conditions, things like cancer. If they're going through chemotherapy, we know that chemotherapy will accelerate the decline of a woman's eggs, and so it could be used in that scenario. It can be used in women with severe endometriosis. They may be about to embark on significant surgical treatment that could compromise their egg reserve, and so doing egg retrieval and freezing prior to that process is an option. We know it's used for women who act as donors for other women. It can be used in elective purposes. And that's really the context I want to talk about today, where a woman can elect or choose to collect eggs and cryopreserve them or freeze them to enable her to maintain her reproductive options at a later time. It might be that she's not ready from a career point of view, or perhaps she hasn't found the right partner to actually move forward with her family in this moment. And so elective oocyte cryopreservation is an option to maintain that reproductive autonomy at a later time in life, because what we've learned is that it's not the age of the womb that really impacts on the ability for a woman to conceive, confirm a pregnancy and have a baby, but it's the age of the egg. And as a woman's born with the set number of eggs that she's ever going to have in her life, and these decline with time, and so the quantity and the quality of the eggs is compromised as a woman gets older, by freezing them in time and freezing a certain number of them enables her to maintain her reproductive autonomy at a later time in life. So it's a really exciting time for women's reproductive health. Now, a lot of women ask me the question, well, how many eggs should I freeze in order to guarantee myself the best chance of a live baby in the future? And a lot of women will say, isn't it better to freeze embryos? Well, I guess by freezing embryos, you're going to have taken the male factor into account, but we really can't in Australia move forward with embryo freezing unless the couple has deemed infertile. So the other thing too is that it's the egg freezing that maintains the woman's reproductive autonomy, and that's what the elective oocyte cryopreservation really is all about. So how many to freeze? Well, there is no Australian data on this, and as you can already see, there's a wide variety of women who are going through this process. So it's very difficult to predict exactly how many eggs a woman should freeze. Plus, it's going to differ depending on their age, and there is some international data looking at this. So for a woman in her early to mid 30s, she would need to freeze approximately 15 eggs, mature eggs, in order to have a 70 to 80% chance of a live birth in the future. Now, obviously, if she's wanting more children than this, then she's probably going to have to freeze in excess of 20 eggs to give her the best chance of a family in future. And the reason for this is that not all eggs will fertilize when they're inseminated with sperm. Not all of those fertilized eggs are going to make it through to a blastocyst, which is a day 5 embryo for implantation. And then not all of those transferred embryos are actually going to result in an ongoing pregnancy and ultimately a live birth. So there is this attrition rate, and that's why we need to collect as many eggs safely as we can to give women the best probability of a live birth in the future. So how many cycles would a woman actually have to go through in order to get that magic 15? Well, again, it comes down to what is her ovarian reserve. How many eggs at that time in her life has she got in storage to be therefore collected and then frozen? And so we'll often perform a test of ovarian reserve, usually an AMH anti-Müllerian hormone and or an antral follicle count to help us determine what is the likely approximate number of eggs we're going to collect from that woman. And ideally, we want to be aiming somewhere between 10 and 15 eggs collected to give us the safest option, because when we aim for a higher number, we also increase the chances of that woman developing ovarian hyperstimulation syndrome, which is a recognized side effect of hyperstimulation. So how do we go about this process? Well, doing an oocyte cryopreservation cycle is very similar to the beginning part of an IVF cycle. So a woman will have been taught how to use the medications. The aim of the medications is to not recruit just one follicle, but to recruit the group of follicles that would have come through in that month. And that's a daily injection and pretty much starts from the first day of their menstrual cycle. So they would ring up our nursing staff, they would say, hey, I'm on my first day of my period, and then they would start the medication as advised by the nurses. That daily stimulation is then followed by blood tests and ultrasounds, maybe 3 or 4 over a 2-week period, to the point where we've got maximal stimulation of as many follicles as possible in a safe manner. And then that woman would go through an egg collection. And depending on the clinic you're with, this can be done under sedation or it can be done under a general anesthetic. And those eggs are collected vaginally. We call it a transvaginal oocyte aspiration. And those eggs are then taken to the laboratory, assessed for maturity, and only mature eggs are frozen. And then those eggs can be thawed out at a later time, and the process of ICSI, intracytoplasmic sperm injection, is used to fertilize those eggs with either a partner sperm or even donor sperm in the future. So hopefully that's given you a little bit of an overview of what oocyte cryopreservation is all about. If you have further questions on that, please don't hesitate to send them through, and please share this information with as many women as you can. We want women to be as educated as they can about their own reproductive choices in life. Have a great day.